Nigerian hospitals, including the renowned Obafemi Awolowo University Teaching Hospital, are shutting down wards as doctors and health workers relocate abroad due to poor working conditions and recruitment failures. The Nigerian Association of Resident Doctors confirmed a worsening shortage of medical professionals, with the Behavioural Science Psychiatry section of the hospital being the latest casualty. NARD President Dr. Dele Abdullahi warned of the dire consequences, revealing that the one-for-one replacement policy is proposed to address the acute shortage, with 900 doctors leaving the country between January and July 2023 alone. He emphasized the urgency for government intervention to avert further deterioration as the healthcare crisis deepens, with hospitals grappling to provide adequate care. And joining me to talk about these on the news is the Welfare Secretary, Association of Resident Doctors, Lagos University Teaching Hospital, Dr. Shittu Taiwo. Good afternoon, Dr. Taiwo. Glad to have you join me.
Good afternoon, Adebola, and I'm glad to be here too.
Now, the Nigerian Association of Resident Doctors confirmed that a ward at Obafemi Awolowo University Teaching Hospital in Ile-Ife, Osun State has been shut down. What are your impressions of this?
Okay, well, to start with, I think that the issue of this health sector drain, in terms of the staffing of the hospitals, not just doctors this time around, other healthcare professionals, nurses, and even some admin staff, it's getting worse across hospitals in Nigeria. Even the renowned hospitals, like you have put them, are no longer having professional healthcare staff to work in the hospitals. It's a situation that over the last 2 years, it has been ringing in the ears of everybody, both the populace and the government, about the worsening situation of healthcare professionals leaving the country. I think it's a very sorry state for us, and ultimately it would have a toll on the healthcare delivery service in Nigeria.
Now, Dr. Taiwo, this particular hospital that shut down a ward in Obafemi Awolowo University Teaching Hospital in Ile-Ife happens to be a psychiatry session. What do you think this would impact on people seeking medical attention in that regard?
Okay, yes, it's very, like I've mentioned earlier, that it's a very sorry state for our country. And now for a department, for instance, I cannot validate the news because I've not heard from anybody in Ife. But what I can say generally about the brain drain that we have in our country at the moment is that you know that a lot of us have talked about the quantitative depletion of our healthcare providers. Now there's something that is even worse than that. That's the quality of service that we have. Because if all our best minds in the healthcare sector are leaving the country for greener pastures, and I mean, a lot of them have complained about the hardships that they have had to go through, especially in their early days in these countries when they go there. But still, a very high number of doctors, nurses, and other healthcare providers are leaving to go to these countries to go and suffer, in quotes. So it's a really sorry state. So eventually, what we'll have, even with our appeal to the government to replace all the doctors that are leaving, is that at the point we'll just be having those that we have on ground to fill up the spaces in our hospitals. Okay. I don't know if you understand what I'm saying. That some people that may not even want to practice at this point, they just go into the hospitals, and then there's a qualitative drain in the healthcare delivery that we have in our country. Which is an even worse situation.
Now, Dr. Taiwo, give me an idea of a Nigerian doctor's welfare package during housemanship and post-housemanship, as well as other packages in terms of their welfare. Just paint a picture for us.
Okay. Yes. The the average Nigerian doctor after school, after graduating from school, has to go through the housemanship period, where at the moment they are being either paid by the federal government under NDCN or for a state if they're working under a state institution. Now, the states that we are right now, apart from the poor economic remuneration that our doctors earn in terms of after working extra hours to be able to see the very large number of patients that they have to see. Now, an average Nigerian doctor does not cannot exactly say that I've worked for this month and at the end of this month I'm expecting to have my salary.
But how much is the salary? That's what we'd like to find out. Paint a mental picture for us. Apologies to cut in short there, but I want to understand, give us a mental picture. How much does a Nigerian doctor earn while you're doing your housemanship and post-housemanship? Just to give us an idea, give us a sense of what it is they take home.
At the moment, yes, I got your question. Thank you very much. At the moment, the average house officer, for those that are working under, that are being paid by the federal government, are earning about 200,000 naira a month. If I'm not mistaken. Then for other institutions, maybe the state-owned hospitals and other centers, maybe a little less than that. And that's for the housemanship period. After housemanship, it depends largely on where the person is working. So for those that are in the residence training program, like myself, it's usually a range from about at the moment with the new implementation of the hazard allowance about 300,000 and above, and just a little above 400 for depending on the CADA, the resident doctors. Okay. So that's for the resident doctors. Yes.
Right. Thank you for that information. Just one final question before I let you go, Dr. Taiwo. We understand that the National Assembly is deliberating a bill to mandate doctors to Nigeria sign and stay back for a period of 5 years before they are allowed to go abroad. What do you make of that bill being proposed by the National Assembly?
Okay, I actually find it very preposterous, honestly, because the major problem, apart from those that we have been highlighting over the past 2, 3, 4, 5 years now, is even the issue of the ideology of our people in government towards this situation. Now, the situation is very bad, as it's actually in a critical state right now. But the major problem that I see is that the people in government don't even appreciate the severity or the critical nature of this situation at the moment. So hence, they are not exactly addressing the root cause of this migration of doctors and other healthcare providers out of the country. Rather, they are looking for ways to compel people. It's a form of coercion. People have the freedom to, the right to freedom to practice or to work wherever they choose to. So I think that rather than imposing that on the doctors or the healthcare providers, they should make the country attractive enough for people. I know quite a number of people that innately they do not wish to go outside Nigeria, but the situation of the country, the economic situation of the country, and all the practice environment leaves them with no choice than to take the opportunities that they have.
Thank you so much for your time on the news, Dr. Shittu Taiwo, Welfare Secretary, Association of Resident Doctors, Lagos University Teaching Hospital. Thank you once again.